Hello, and welcome to Doc Talk. I'm Tara Perre, Race Director for the Community First Fox Cities Marathon presented by Myron Construction. And Doc Talk is your chance to ask questions of all of our medical experts. And we have some great folks that are joining us in this series this year from our partners Ascension, Theta Care, OSI, and OSMS. And joining me today is Dr. Jennifer Steinhoff of Ascension Sports Medicine. Welcome, Jennifer.
Hi, thanks for having me.
It's great to see you again, and I love your backdrop. For those that you don't know, Jennifer has the background of one of our trails back there, so it's kind of fun to have her on today with our beautiful course behind her. Today, we're going to dive into a couple of topics deeper that we know that you have questions about. So one is arthritis and what running may or may not do to cause that or make it worse or whatever. And then also pregnancy, what it's like to run through pregnancy. So first, we're going to start with pregnancy. So, a common question is it safe to train for a marathon while you're pregnant? So Jennifer, any advice that you have for our folks out there?
So just the general topic of exercise and pregnancy. Exercise is definitely safe for the most part during pregnancy and actually recommended. Pregnancy is sometimes maybe thought of as sort of an illness or, something abnormal, but actually it's a normal, stage of life for many women. And so it shouldn't necessarily be thought of something where you need to do something totally different or stop doing certain activities. There are certain sports or activities where at certain points in pregnancy, they might not be recommended, but things like running and walking are certainly acceptable. Of course, there's always the caveat of, talk with your doctor, make sure that there's nothing that would make you high risk or, certain situations such as bleeding or history of early delivery or high blood pressure in pregnancy or things like that. Those might be situations where it would not be recommended, but in a normal, low risk, healthy pregnancy, if you were active before pregnancy, generally you can continue at the level of activity that you were doing. So if you were a runner, you can continue running. If you weren't a runner, it's not necessarily the time to start really, setting a big goal to start running a lot of distance, maybe starting with a walking program and then progressing from there. But certainly it's not something that you need to discontinue.
Right. So if you're a runner, you can keep at it, but just, be mindful of your body and if it's giving you any signs. So what might be some signs that maybe you're pushing yourself a little too hard if you are running throughout your pregnancy?
So the general rule of thumb is just to kind of be aware of how you're feeling, what your body is feeling like, what your joints are feeling like, what your breathing is feeling like. And sometimes racing can be safe, but overall, the goal is not to set new personal bests or break any records or that kind of thing, but more just to feel healthy, to get your heart rate up a little bit, to stay moving. So things to watch for is if you're just not, some women, especially in the first trimester, just feel very tired. And so sometimes women, find that those first few weeks, they're not running very much or maybe not at all. And then sometimes a little bit later on, they pick it back up. And then sometimes later on in pregnancy, they find that it's just not comfortable on their joints or their center of gravity is off and it doesn't feel right. So if at any point it's just not comfortable, not enjoyable, then that's a point to say, well, maybe I need to reevaluate this. Or, if somebody is having nausea, vomiting, not able to adequately hydrate, that could be a risk. Bleeding, things like that. Those are things to watch out for. And every woman is different. Every pregnancy is different. So, one woman might feel fine and run up until the day she delivers. Another woman might find that 6 weeks in, 12 weeks in, it isn't right for her. And then, same woman, different pregnancy might find that, that one feels different, or, she runs to a different length of time. So there aren't any rules, but more just listening to your own body and your own comfort level.
And the nice thing about pregnancy is you are seeing your doctor a lot. So I would say keeping that dialogue open with your physician is probably the best rule, right? So if you're a runner, maybe it's you just keep your doctor updated on how you're feeling, what you're doing, and asking questions of them. And do you think is that a good route to go as well?
Absolutely. I mean, it's nice to have those check-in visits, monthly at first, and then every couple of weeks, and then weekly as you progress. Just, if you have any questions, if you're not sure, is this pain that I'm feeling in my hip just ligament pain, or is that something that I should be kind of backing off on and, taking some rest time or doing something different? And, sometimes it means a trial of physical therapy, or, trying one of the pregnancy belts or something like that. And sometimes it's, well, let's try some pool exercise that kind of takes the weight of the baby off of the lower joints, and maybe that feels better. So talking with your doctor certainly can be helpful, and seeing if they have, other suggestions or further evaluation is needed, or, kind of what the next step might be.
Awesome. Well, good. Well, let's shift gears and talk about arthritis. So I know you see a lot of people that are dealing with arthritis, and I think people often wonder, can running cause arthritis? So I'll let you tackle that topic.
I have lots and lots of people and patients when they find out that I'm a runner saying, "Oh, you're going to ruin your knees." So I think it's a common myth out there, and so I will tell you that there is no evidence at this point that running causes arthritis. So I would not let that be a reason to stop. Now, people who have arthritis already may find that running is not the activity that feels good to them. A lot of times lower impact activities like biking or swimming might feel better, but there are people who have arthritis who can continue to run. But as far as we know, running does not cause arthritis. One study that I saw showed that recreational runners, which I think they defined as running less than 50 miles per week, were actually less likely to have arthritis. And then competitive runners, which was higher mileage and potentially higher speed, were maybe slightly more likely to have arthritis than the general population. But overall, the benefit outweighs the risk. So I can go on and on about benefits of running, just, beyond just the, staying in shape, but also the mental health benefit, the heart and lung benefit, lower cholesterol, lower blood pressure, all the things where exercise and running can be helpful. So, even if there were a slight difference in developing arthritis, probably wouldn't be significant enough to not recommend running.
Very interesting, because I think that is a common myth. I'm glad you used that word, because I have heard, other people ask that question, and I've never known for sure what the answer is. So I appreciate your insight there. Any other kind of just general tips that you'd want to share with us today before we wrap up?
I guess just in regards to injury evaluation, or kind of, what's significant enough to get seen versus what can I kind of keep an eye on at home. If something is persistently bothering you for, a week or two, not getting better, if something is causing you to change the way that you move, so you feel like you're limping, or your pain is on the inside of your foot, so you're trying to land on the outside of your foot and feeling awkward. If at any point you have a more significant, a twist or a fall where you feel like you can't put weight on a joint, those are things where I would get evaluated sooner. So if it's something where it's kind of mild and you're able to kind of deal with it, but it's getting past a couple of weeks, I would go in. But if it's something more severe where you're having trouble moving normally or putting weight on it, I would go in within a couple of days. And then, you know, if you had a more significant fall or something and had something where you felt like you had a deformity or significant swelling, or, you know, were worried about a fracture, dislocation, something like that, then I would go in, you know, that same day.
Yeah, that's more of those immediate go in right now. I think most people realize when they need to go in right now, right?
Usually, but sometimes we get surprised. So I guess it's always good to kind of give all the possibilities.
You don't have to be tough out there, everybody. You can come in when it's feeling like you need to see somebody, right?
Yeah, and I guess the other thing that I will put out there, I know that there are a lot of people who put off coming in because their biggest concern is that they're going to get told that they need to stop running. And my goal as a sports medicine doctor is not to stop people from running, but to keep them running. And on occasion, that may mean taking some rest or doing some cross training, but the end goal is to keep people doing what they want to be doing. And if that's running, and if there's not a reason that it's unsafe, we have lots of tricks and tools. So if you come in, you know, we're here to help, and we're not here to tell you, no, you know, that's a crazy idea.
Well, that's great. And, you know, I would think that, you know, people probably are relieved to hear that you're a marathoner and want to keep them running. So it's always good to know that the doctors are on our side when it comes to that. So thanks for that little extra tip, because I bet there are some people out there that won't come in just because they're afraid that they're going to be told, no, you got to stop. And to your point earlier, it really helps with mental health. It helps with overall wellness. So running can be, you know, so beneficial. So thanks for all the tips. It's been fun talking to you today again. You know, thanks everyone who's watching. We'll continue to do these and continue to send in your questions so that we can dive deep into some of the topics that you're maybe have some worries about, or maybe you just, you know, you're wondering, you want some doctor expert advice. So you can send that to info@foxcitiesmarathon.org, and you'll be able to find these doc talks on our website, foxcitiesmarathon.org, or you can follow us on social media. So thanks again, Dr. Steinhoff, for joining us today.
Thanks, and looking forward to seeing everyone out there.
Definitely. We'll see you all in September.